1003400608, and my service improvement proposal is all about improving communication with patients. So I will be using the 6-stage project management approach to guide the implementation of this project, which is the framework for service improvement within the NHS and widely accepted in the healthcare. And it breaks down, of course, the challenges of implementing change in the healthcare setting into manageable spaces. So to start with, what is communication? So communication, as we all know, is important in promoting effective nurse-patient relationship. And it's one of the 6 fundamental values of nursing, as you are familiar with the 6 Cs, as part of the government's strategy to improve patient care and achieve optimal health outcome. So the NMC also makes explicit our role as a nurse to communicate clearly and listen to people and respond to their needs and preferences. So Lederman in Switzerland, interestingly, drew together the results of an inpatient survey that was conducted in NHS, and what the public want from the NHS is to have good patient-professional interaction, good communication, and patients wanting to be treated as an individual. Our communication in critical care, of course, can be affected by a lot of factors, including the fast-paced, highly technological environment, the nurses with their workload attending to 1 or 2 patients with multiple tasks, which can lead to lack of time, the patient's condition as well, cognition, and mechanical barriers like intubation can affect communication. And of course, the resources when we have limited information about the patients, just as like purely medical information. So what is the current situation? So there's already an implementation of it all about me in the unit, but this is a paper version. And there was non-compliance at all in the unit. And the staff found the paper version is very lengthy, time-consuming, and not easily visible because they had to peruse the chart to access the information. And the patient's whiteboard is just limited to the patient's name, attending professionals, and the patient's nutritional needs. So based on the feedback and comments of patients that were discharged from critical care, lack of isolation can actually lead to patients feeling isolated. And another patient commented like feeling very dehumanized or objectified when he was feeling very unwell, and nurses and doctors were all over him. However, a nurse who took time to communicate with the patients about not just about the medical condition, but about her life, created a positive impact into her overall critical care experience. My proposal is to implement a patient-personalized poster to promote meaningful conversation with nurses and patients in order to enhance patient care and experience. So this is a poster that will be displayed at the patient's bedside, which contains personal information about the patient that nurses can use to engage with patients in a meaningful way. My objective is to achieve 50% compliance in the use of poster in ICU in 3 months, evaluate patient and staff satisfaction with the poster, and also evaluate the effectiveness of a poster as a communication tool with ICU patients, which can be done through feedbacks, comments, and SIP evaluation form. Of course, stakeholders is necessary to, of course, determine whose interest we need to get involved in implementing a change. And matron will be kept satisfied because she has the capacity to unlock resources and champion this project. The patients and the nurses will be the key players, which have high influence and high power in this project, because they will significantly impact on how this project progresses. The relative support workers and ward clerks, of course, will receive regular updates because they might be involved in the future and added support to the project. So other healthcare professionals as well in working critical care may have very minimal interest or influence in this project, but we'll keep them updated on what's going on. So just to say, what are the benefits and impacts? So this project proposal has been implemented in various settings and in different populations, which shows the transferability of this project. So the NHS Scotland is promoting a What Matters to You campaign, which is actually is an initiative in their healthcare wherein nurses engage with patients in a meaningful way through asking them in day-to-day conversation what matters to them, or giving them a What Matters to You board, which is actually discussed during ward rounds and or during giving patients care. So post-thematic analysis, it shows that result of that leads to a more patient-centered care. There was an efficient delivery of services. There was an increase in job satisfaction. So post-implementation of this proposal in an adult ICU shows an increase in the nurses' caring score. And of course, the critical care experience was more positive and the patients felt more humanized and critical care experience was more endurable. Just recently, this proposal was also implemented last year in the pediatric ICU in London, and that was a significant improvement of how healthcare professionals knew their patients and what comforts them. And using this in a transitional unit in an NHS hospital, it shows that use of life stories strengthen relationship with patients and families. So the design and implementation of this project, the design and content, of course, will be done by the staffs. The resources is available. So the authors unit has an in-house printing machine which can produce and laminate this poster. And being laminated, it can easily be wiped out and used for another patient when they get discharged. So making this makes this proposal a very simple, cost-effective, and very sustainable to improve patient care. So this is the sample of the storyboard which will be implemented in the unit. Not only includes the patient's interest, what does the patient use at home to communicate, the patient support system, and an opportunity for the nurse and the patient to create daily goals, allowing the patient to be more involved in their care. And of course, photos. So to implement this project, I will be using the Lewin's theory of change, which is composed of three stages and the PDSA cycle as well. So the Lewin's theory of change is based on team building, teamwork, and it focuses on giving the key stakeholders the necessary knowledge to bring about change. So and then the unfreezing stage is all about preparing the organization for change through giving them information and evidence that the change is necessary. So the unit has various communication methods that we can utilize to gain supporters for the project or as the staff buy-in. Then it proceeds to the movement stage, which is the implementation of the poster itself. I will be using the PDSA cycle into this because this will be implemented in a very small scale population first before implementing it in the whole unit to address first any barriers that were recognized during implementation and make the necessary changes. And their freezing stage is when this poster is fully embedded in the unit and it becomes the new normal in the critical care. This is how it is. This like a map of how this will be done in the critical care. So the nurse first will explain the purpose to the patient and gain consent. The patient fills out the poster, and they will display it in a visible location at the patient's bed space and use that as a reference to initiate conversation with the patients, thus promoting meaningful conversation between nurses and patients. So inclusive criteria for the patients as well would include the physical ability to fill out the poster if safe to do so, and they should have the mental capacity to provide consent. Otherwise, the next of kin can act on behalf of the patient. So Lewins also introduces what you call a force field analysis to manage resistance. He theorized that the driving forces or the driving forces must outweigh the resisting forces to be able for the change to be successful. So resisting forces identified in this project from the part of the nurses would include lack of time. They may lack the conviction also that change is necessary, and they may perceive this as an additional task as well. So on the part of the patients, they may have resistance to share information about themselves. The driving forces for this project is that this proposal promotes a patient-centered care. It also improves patient experience. This is supported by management because this has been previously implemented before, and there's already established nurses knowledge of the importance of having this because this was already implemented in the unit, and there's available resources to put this project into completion. So to manage resistance, Kotter actually suggests strategies to be able to make any change successful by ensuring that there is an open communication with key stakeholders, ensuring that they get involved also, or there's in participation on the part of the key stakeholders by making them more involved in all aspects of change, and of course offering facilitation and support. So to sustain this project, of course, we will be using an audit tool to monitor compliance and use of the poster. We will encourage also the use of post-unrelated. It's important during team huddles, obtain feedback from key stakeholders, share the results, and most importantly, recognize success in order to improve the staff morale. And that's it. Thank you.
Vilma, just leave that slide up for a moment.
Yes.
Okay. Was there a second there? There we are.